Hi, I'm Joe, an anaesthetic registrar at Southampton, and I'm going to present the early findings from EPIVA, a small randomised feasibility trial that I set up and ran over the last few years, which compares the effects of EPIVA and volatile in kids on several different biological pathways, including epigenetics. So, there's a lack of paediatric research in general, including in this perioperative space. This is despite concerns about the potential long-term effects of anaesthetic drugs on children, particularly on their neurodevelopment. Epigenetics describes alterations in signals on DNA that impact gene expression and is thought to be a potential mechanism by which these drugs may cause harm. Several other biological pathways have also been implicated in this. We wanted to know if our choice of using EPIVA or volatile impacted change at this level, and whether this kind of work was feasible with all the challenges that come with paediatric research. We took 16 kids under 3 having urological surgery and randomised them to EPIVA with propofol and remifentanil or volatile with sevoflurane, and took bloods before and after surgery for comparison. So here is a small selection of our blood results. All these markers show the same directional change for both anaesthetic types, but the size and whether it reached significance varied by anaesthetic type. You can see neutrophils increase and eosinophils decrease by the end of surgery, but this is to a larger extent and reaches significance for EPIVA and not volatile. The same seen with other white cell subtypes. For redox and inflammatory markers like FRAP, which goes up, and TNF-alpha, which goes down, again the direction is the same for both anaesthetic types, but this time the change is larger and reaches significance only for volatile anaesthesia. The take home here then is that EPIVA and volatile appear to show distinct biological patterns. Our epigenetic analysis looked at gene sets from 3 different libraries and repeatedly showed far greater epigenetic change in response to volatile anaesthesia compared to EPIVA, as you can see from these percentages. A filtered analysis interestingly also showed that there were significant changes in some neurodevelopmental pathways seen exclusively in patients who received EPIVA, and some changes in hypoxia response pathways that were exclusively seen in the volatile anaesthesia group. These results all indicate that choice of anaesthetic also impacts epigenetic profiles. So, we've shown this work is feasible, and this was a genuine unknown when embarking on EPIVA. Our work is very much exploratory, but suggests that choice of anaesthetic agent impacts the processes in the ways that we've highlighted. We continue to try and investigate potential relationships between the changes we've seen, and want to go on to see if these translate to changes at a transcriptional and translational level, and ultimately if they result in clinical change. As a community, we're doing fantastic work like the VITAL trial comparing EPIVA versus volatile for our adult population. So why can't we do this sort of work for the children we look after? Thanks especially to the kids and family who took part, and thank you for listening.